In this video, I will teach you how to do trach care and trach suctioning. Mr. John will be our patient today, and he has an indwelling tracheostomy with humidified oxygen. And so we will show you how to remove that, how to suction him, and do it all in a sterile technique. What you need to do is gather supplies. So we have our normal saline irrigation solution or our sterile water. We will use our tracheostomy care kit. And then this kit, because it does not have a tracheostomy, a tubing to suction tubing in it, we will have a separate kit that has just the suction tubing and additional sterile gloves. So we'll put all of that here. We also have a more trach ties. If you want to change our trach ties, there are trach ties in your kit, but we sometimes will use the ones with the Velcro. The last thing that we will have is our suction. So we have to make sure that we have suction attached to our patient, okay? That will give us the ability to be able to suction all the mucus and everything, or to clean out the trachea and suction it out. Everything that we do as far as tracheal suctioning is sterile. So we need to make sure that it remains a sterile technique until we're done. So let's get started. What we'll do is we'll come in, we will introduce ourselves, we will do an assessment on our patient unless they're in trouble, but we will do an assessment on them and introduce who we are and tell them what we're going to do, and then do 2 patient identifiers to make sure that we actually have the correct patient. Once our patient is agreeable, then we will go ahead and start setting things up. So I'm going to position my patient. I'm going to lift the head of the bed up as well as the height of the bed a little bit, just more for my own working height. And then I will let the patient up a little bit. All right, so he's got oxygen on. We want to make sure that we leave that oxygen on until we're ready to suction. So we'll start setting things up here. We will always open our kit, everything that comes sterile. We know that we start with the side corners and we pull backwards, and keeping everything sterile, never touching anything inside. In this particular kit, there are gloves that are right on the top. So I will start with thinking about my own sterile gloves. But before I put on any sterile gloves or start any procedure, I want to open up my water here and take the top off, because once I become sterile, I cannot open anything. So I'm going to open up my irrigation or sterile water and leave the cap off here. I'm going to go ahead and turn on my suction that's back here. So I'll turn on my suction, and now I'm ready to go. So I have my suction tubing here. I've got my patient with his oxygen here, and I've got all of my supplies right here. So what I'm going to do is go ahead and put on my sterile gloves. So I'm going to take one glove, and I'm going to step back from over my sterile field, and I will put on my glove, making sure that I don't break sterility. So I've got one glove on, and now I'm going to go ahead and put the second one on. Make sure that you don't touch anything to break sterility. So you have to be really careful about putting your gloves on. So we've got both gloves on and we're sterile. So now everything else in our kit we can actually touch. So in our kit we have some cotton tip applicators, which we'll use later to do the trach cleaning. We have a pipe cleaner, which we will use to clean our inner cannula of our trach. We will do that as well. And then we have our fenestrated sponges that we will use to put around our trach as we clean those and move them. And the final thing that we'll have in here is some gauze that we will use to put a little saline on and use it to clean around our stoma site for our patient. So we'll take all of that out, and we will take, before I start, what I'm going to do is actually I'm going to just take our other little drape here that we have, and I'm going to use it to kind of help me with and create like a little sterile feel on my patient, so that I don't actually touch my tubing as I'm suctioning. So make myself just a little bit, and the shiny side goes down. So I just kind of made that. Now I've got everything out. So now my dominant hand should stay sterile at all times. My non-dominant hand is going to actually pour some saline in here. It's going to we're going to use it again to clean our inner cannula, and also we'll use it to saturate our gauze to clean around our stoma. So now we've got that. Now I'm going to contaminate my non-dominant hand, because inside of my other kit is my I'm going to pull out my suction catheter, which should look something like this, okay? Now, this is all sterile, but my non-dominant hand now, I'm about to actually contaminate it. I'm about to contaminate it. So I'll take that and I will push it in here, being careful not to let my hand on this side touch anything. I have at the top my little hole here, if you can see that little opening there. That's what I'm gonna put my thumb over when I'm ready to suction, and we always suction coming out, okay? And never more than 10 seconds, okay? All right, so now I've got my suction on, I've got my canister ready. I am going to go ahead now and move my oxygen. Make sure your patient's attached to vital signs so you can see their oxygen saturation at all times. We do expect that their oxygen may drop a little bit while we're suctioning because we're removing oxygen. But at any point in time, so we always want to be monitoring this patient. We want to be monitoring color. We've already assessed our patient to make sure that they're still doing well during our moments when we move their oxygen. All right, so contaminated hand is going to now put my little oxygen to the side. We'll keep it right there so that we can cover it back up. And then what we will do is go ahead and start our suctioning process. So we will go inside, all right, until we meet a little bit of resistance. Your patient may even cough for you a little bit, all right, now that we've got it. And so on our way out, we will cover our thumb and we will rotate and we will do this as we actually come out, okay? No more than 10 seconds. We can keep our hand here, give our patients a little bit more oxygen if they're okay. Again, do we want to reassess how are they feeling after that one suction? How are they feeling? Did we make an improvement? If not, we might want to go back in. I would suggest not doing this more than 3 times unless your patient's in trouble. All right, so we're good. Our oxygen looks good. We've given him some more oxygen. We'll put our oxygen back to the side and we will go in and suction at least once more if we should need to. All right, in. And now on our way out, we're coming out, we're suctioning, we're rotating, we're getting it, we got all the oxygen, all the mucus out. Yay, he looks great. Our oxygen back. Now, sometimes I will use a little bit of my little sterile water that's in here and just kind of clean out my tubing. So in here, put my little thing in here and put my thumb over my little suction piece. And now my tubing has all cleaned out so that I get rid of all the nasty stuff if it's too thick. If it's not, then we're not worried about cleaning because once we've got everything done and we're through suctioning, we're done with this. So we don't need to worry about keeping it clean or sterile anymore. What we will do is that we will wrap it, fold it, put it inside of our gloves, pull our gloves off with it inside, and discard all of our stuff. Again, reassess your patient vital signs. How did they tolerate the procedure? And so your sterile part of that is done. We'll let him catch up on his oxygen a little bit, but we're pretty much done with that. We will put away everything, clean our hands, wash our hands. Now we can put on actually just regular gloves to actually be able to move to the next piece because all we're doing is outside. So we've got him and we're good and clean. So what we're gonna do is we will take out our little inner cannula here. We're having a hard time getting this one out. With my keeping this piece from touching anything, it's going to go right into our sterile water basin. All right, it'll go in there. We'll let it soak a little bit while we're cleaning around our here. So I've got to put on more gloves. I would put on more gloves at this point in time, and they can just be clean gloves. This is now just an aseptic technique. And I would take all of these old dressings out with my clean gloves and throw them to the side. And then if he has them, like if you can see, I don't know if you can see here, he's got like a trachea collar that looks something like this. And so what we will do with it, I'm going to open this one so you can see it. And what we do with it is as we change it, we want to take only one side out at a time. So this will be our Tracheal that goes around, but we only open one side at a time and work on that side so that we don't dislodge our trach. So we would change this one as well and clean it. So now let's take our little sterile things here, clean our gauze here, and we would use our little tips. And I always bring me extra of these with me because the kit sometimes only has a couple in it. And just kind of clean around the trachea site, around the stoma site, really good and clean, get anything soil. And you don't necessarily need to change your ties unless they are actually soiled or dirty. And generally when it's a brand new patient or your patient's got a lot of mucus, those are gonna need to be changed. So we would use these once, discard them, all right? And then we would use our regular gauze here. That's wet also, and we could just clean down one side. And remember, I have on gloves, you just don't see them. All right, we would clean down one side, and then we can also do the same with another clean one. We just take another clean one that's saturated in saline, and then we would sometimes just kind of clean also on the other side, just kind of cleaning it, bringing it through. Again, never remove both of your ties at the same time. And then you would just take dry gauze and just dry it off. Now, once we've got it all dry and clean and the tracheas look good, we've got our ties all covered, we will actually now take our fenestrated ones, okay, and we will put them in around our trach to put the new ones back. So up through around our trach, carefully not to move it. And it's always good to bring an extra set of hands in case you need them with you. So we would just put this up around our trach, okay? And honestly, we just need maybe one of these, if depending on how much mucus they have. And so there, our dressing is changed. We will go ahead and give our patient back the oxygen while we take and never touch anything other than just the tip of your outer cannula. And now with the saline, we're gonna go ahead and clean it. We're gonna clean it with our little pipe cleaners here. So we'll go in through there and kind of clean it out. We're just getting rid of all that extra mucus that's gonna be inside of there. And so rinse it out, let it dry for a little bit, 30 seconds or so, and then we will move our oxygen and we will put our trach inner cannula back into our patient. Let's see how this is gonna work here. All right, and then snap it into place, put their oxygen back, do another full assessment on your patient's color, what do they look like, what their vital signs are doing, and then that's pretty much it. You've done a full dressing change and you've done trach care and suctioning for in a sterile technique. So I hope that this video helps you. I hope that it helps you learn about trach care and trach suctioning and the importance of it and all the things that you would actually monitor. Okay, thank you so much.